Every minute and 6 seconds in this country, another older adult gets a dementia diagnosis. By the time this video finishes, 20 more families will have received that exact devastating news. But for a lot of them, age was never the real problem. The true culprit was just sitting there on a bathroom shelf. A bottle they were promised was completely safe. Over my 15 years in medic practice, I've watched this exact scenario play out more times than I care to remember. Someone who's been sharp as a tack their whole life suddenly starts losing the plot. They forget names, miss appointments, or get lost on a drive they've done 1,000 times. Friends and family just brush it off as getting older. But it wasn't age. It was a prescription. One that nobody even seconded. Guess because a professional subscribed it and the pharmacy handed over. No questions asked. Recent research is sounding a massive alarm. One extremely common category of every drugs can completely tank your memory and learning skills in under a year. And the wildest part? The vast majority of people taking them are totally in the dark. Today, we're breaking down the 9 medications most heavily linked to rapid memory decline. We'll count down from the sneaky, under, the rather all the way to the one I believe does the most damage of all. Pay close attention to number 3. Millions of seniors take it for something that seems totally innocent. Yet, it might be physically shrinking your brain's memory centers right now without setting off a single alarm. Before we dive in, drop a comment below letting me know your age and what daily meds you take. I read every single one, and knowing who's watching helps me figure out what topics to tackle next. 9. Diphenhydramine. Let's start with number 9. Don't let its spot at the bottom of the list fool you, because this drug is hiding in almost every medicine cabinet in America. We're talking about diphenhydramine. You probably reckon it as that generic lit pink allergy pill. Folks pop it to catch some sleep, calm down some sniffles, or ease a cold. It's cheap. You can grab it right off the open shelf, and because it doesn't need a prescription, most of us just assume it's harmless. But what's happening inside your head is a totally different story. This drug is part of a group called anticholinergics. Basically, that's a fancy medical term meaning they block a crucial brain chemical called acetylcholine. Think of acetylcholine as your brain's postal service. It's the messenger responsible for keeping you alert and locking in new memories. As we get older, our brains naturally make less of it and have to lean heavily on whatever is left in the tank. So, when a 70-year-old takes a pill that blocks this chemical, it hits them way harder than it would a 30-year-old. The part of the brain that takes the biggest hit is the hippocampus, which is the little seahorse-shaped area where memories are created before they get filed away. In my own practice, I've had patients take a nightly antihistamine for years, slow losing their mental edge, and they never once linked that growing brain fog to the pink pill on their nightstand. The science backs this up aggressively. A 20-3 study focusing on geriatric cognitive health followed older folks who regularly use these types of drugs and discovered the risk for developing dementia shot up by 54% compared to people who avoided them. That's more than a 50% jump in risk from something most people eat like candy. Here is the game plan. Check the labels on any over. The counter sleep aids are stuff branded for nighttime or allergy relief. A lot of the time, it's literally just diphenhydramine in disguise. If you actually need it for allergies, consider newer antihistamines like loratadine instead. They don't cross into the brain nearly as much and are considerably safer for the long haul. Never quit a drug without talking to your provider first. But we need to stop pretending that just because a pill is over the counter, it's automatically safe for your mind. 8. Proton pump inhibitors. Number 8 is a lifesaver for your gut, but your brain is the one secretly paying the tab. I'm talking about proton pump inhibitors, commonly known as PPIs, like omeprazole or esomeprazole. They completely shut off stomach acid production and are usually handed out for acid reflux, heartburn, or that fiery feeling after a big dinner. People end up staying on them for decades because the second they stop, the fire comes roaring right back, making it feel like the medication is the only thing holding their health together. But here is the secret the pharmacy usually skips. Your stomach actually needs that acid to extract specific nutrients from your meals. The MVP here is vitamin B12, which literally acts as the protective insulation for your brain and nerve wiring. When you crank that acid down too low for too long, your B2 levels quietly crash. The same goes for calcium and magnesium, two essential minerals your brain cells desperately need to fire off signals. When you starve those neurons, you start getting misfires, severe confusion, and memory glitches that look exactly like early-stage Alzheimer's. Meanwhile, the real culprit is just severe nutrient starvation caused by your heartburn pill. A massive tunic study published in a premier neurology journal looked at over 7 CNCs over the age of 75. Those taking PPIs regular had a 4% higher risk of dementia. And the problem doesn't just stop at nutrients. These drugs have actually been linked to higher levels of amyloid beta in the brain, which is the exact same sticky protein that builds up in Alzheimer's patients. The fix. If you're popping a PPI every single morning, it is absolutely time to have a chat with your provider. A lot of folks can easily transition to a much milder category of acid reducers called Het2 blockers, like famotidine, which rarely mess with your cognition. Even chewing deglysyrrhizonated licorice, a natural compound that coats the stomach lining, can kill the heartburn without sacrificing your brain cells. The ultimate goal is the lowest possible dose for the shortest amount of time, rather than mindlessly taking a pill forever out of habit. 7. Overactive bladder medications. Number 7 is usually prescribed for a problem most folks are far too embarrassed to talk about out loud. We'll look at bladder medications, specifically oxybutynin. It's the go-to script for old adults who have to make frantic, urgent dashes to the bathroom, the kind of severe overactive bladder that practically dictates your entire schedule. The relief it gives is incredibly real, and it saves people a ton of embarrassment. But oxybutynin works by blocking that exact same memory chemical we talked about earlier, acetylcholine. The catch is that this specific drug's past the blood-brain barrier incredibly easily, set up camp right in the very center where your memories form. That makes it one of the most dangerous items on today's list for seniors, especially when taken continuously year after year. Back in 2009, a major British medical journal released a study looking at folks over 6'5" who have been taking strong anticholinergics, like oxybutynin, for upwards of a year. Their dementia risks skyrocketed by 4 to 9%. That is practically a 1 in 2 chance. And here is the part that makes my blood boil. Almost 0 of these patients were warned beforehand. They were just told it would calm their bladder down. Nobody pulled them aside to say it might also be dimming their mind. The resulting brain fog just gets blamed on aging. They start misplacing their keys a dozen times a day, missing doctor appointments, or totally blanking. In the middle of a simple conversation, and everybody just nods and says, "Well, getting older is tough." Nobody ever points the finger at the prescription until a massive amount of cognitive ground has already slipped away. If you're currently taking oxybutynin and you feel your sharpness fading, take that seriously. You do not have to pick between having a functioning bladder and keeping your memories. Newer alternative medications, like mirabegron, tackle the problem through completely different biological pathways without blocking your memory chemicals at all. They get the same jobs done with a fraction of the cognitive risk. Bring it up at your next visit. 6. Statins. This next one might be the biggest shocker on the board because it's one of the most widely handed out prescriptions on earth. Number 6 is statins. Specific ones like simvastatin and atorvastatin are global bestsellers, especially for anyone north of 60. Let's be clear, they do absolutely crucial work when it comes to aggressively dropping cholesterol and cutting the risk of fatal heart attacks or strokes. Statins have a rightful place in a lot of people's lives, and I am not telling you to stop taking them. But you are about to hear the half of the story that usually gets left out. Cholesterol does a heck of a lot more than just affect your heart. Your brain is essentially made up of nearly 60% fat. It heavily relies on cholesterol to build the myelin sheath, the protective insulation wrapping around every single nerve so that your brain's electrical signals can travel cleanly and fast. If you push your cholesterol levels down too hard with an incredibly potent statin, you can accidentally leave the brain short of the exact raw materials it genuinely needs. The statins causing the most trouble are the lipophilic ones, meaning they pass effortlessly straight into brain tissue. A 2023 neuroscience study showed that adults over 70 who had been on statins for over 3 years had a 26% spike in mild cognitive impairment. And the higher the daily dose, the sharper the memory decline became. Patient described terrifying gaps, suddenly blanking on a familiar name, having zero memory of a conversation just finished, or find a driving route they've taken for 20 years suddenly unfamiliar. The key takeaway here is that not all statins treat your brain identically. Options like pravastatin or fluvastatin don't penetrate the brain nearly as aggressively and are widely considered much safer picks for preserving cognitive function. So, if you've been on statin therapy for years and you're starting to notice fog, forgetfulness, or confusion, that is a highly valid conversation to have with your doctor about lowering the dose or making a switch. It is absolutely not a reason to secretly quit a medication that might be guarding your heart. Get the plan right with professional guidance. Never solo. Quick time out. If this breakdown is help you finally connect the dots, please take 1 second to tap that like button. It truly helps push this video out to other seniors who desperately need this information. And while you're down there, drop a comment telling me exactly how many prescriptions you're juggling right now. I read every single one. All right, let's get back to countdown. 5 benzodiazepines. Coming in at number 5 are benzodiazepines. You'll see these labeled as lorazepam, diazepam, or alprazolam. When it comes to treating insomnia or severe anxiety, these rank among the most commonly prescribed drugs in America. They work by boosting GABA, which is your brain's natural calming signal that dials down an overactive nervous system. In the beginning, they feel like a lifeline. The racing thoughts slow down, the panic eases, and sleep finally arrives. But over time, the picture gets dark. A prominent 2022 medical review tracked over 8,000 seniors for 6 years. They discovered that people who used benzos for longer than 3 to 6 months experienced a 500% massive spike in their risk of developing Alzheimer's disease. The longer-acting versions, like diazepam, are even riskier because they linger in the body longer, accumulate inside fatty tissues, including the brain. What these drugs essentially do is produce a slow chemical sedation across your entire mind. Learning slows down to a crawl. Mental flexibility completely drops off. Many folks describe a heavy emotional numbness, like they are permanently moving through a fog and no longer feel like them. The cruelest part about these drugs is the exit. If you quit cold turkey, the insomnia and anxiety usually comes screaming back even stronger, often paired with a dangerous level of physical agitation. It tricks you into believing you desperately need the pill at exactly the moment it might be doing the most harm. The golden rule: if you have been taking a benzodiazepine for more than a few weeks, absolutely do not stop suddenly. Doing so can be life-threatening. You have to work closely with a doctor to taper down gradually over weeks or even months. Gentler alternatives absolutely exist. Meds like buspirone can ease anxiety with a heavy sedation or mental fog. Plus, specific types of talk therapies built strictly for sleep and anxiety permanently restore your calm without a cognitive toll. 4. Amitriptyline. Number 4 is a single medication prescribed for 3 totally different problems, and it carries one of the heaviest hidden burdens on this entire list. We're talking about amitriptyline. It's an old generation antipsychotic that is still heavily prescribed today to treat nerve pain, sleep troubles, and even to prevent migraines. Its versatility is exactly why it became so massively popular. It looks like a drug that can do it all. But beneath the surface, it is one of the most potent anticholinergic drugs still in regular use. That means it aggressively blocks acetylcholine, the exact chemical your neurons demand to communicate and store new memories. Suppresses it so forcefully that with long-term use, memory problems stop being a rare side effect and start looking like a guaranteed outcome. A comprehensive tuned-fin-fine internal medicine study tracked over 3-4-ounce adults aged 6'5" and older. The folks who racked up the highest cumulative exposure to strong anticholinergics like amitriptyline over a 10-year span saw their dementia risk explode by 54%. And almost none of them were ever warned the pill could do that. They were prescribed it for a bad back or a rest night's sleeps, then gradually noticed their words slipping away, their concentration shattering, and simply chalked it up to getting older. It doesn't even take a high dose. A tiny night dose, taken for a few years, can quietly erode your cognitive function with zero obvious warning signs until the loss becomes severe. If you or someone you love takes amitriptyline, you need to have a conversation with your provider soon. For nerve pain, options like duloxetine or gabapentin can provide similar relief without nuking your brain chemicals. For sleep, melatonin or a very low dose of doxepin are considerably gentler on this pathway. For mood disorders, modern antidepressants like sertraline or escitalopram are never considered far safer for long-term brain health. 3. Paroxetine. All right, we've hit number 3. I flagged this one at the very beginning because it is prescribed to millions of people for something that sounds entirely harmless. Number 3 is paroxetine. It's an incredibly popular antidepressant belonging to SSRI family, heavily used to treat both depression and anxiety. On the surface, it appears to be a clean, modern, gentle option, way kinder than many older psychiatric meds. But here is the massive red flag rarely discussed. Paroxetine is the single SSRI that packs strong anticholinergic activity. That one unique chemical trait completely separates it from its cousins, like sertraline or escitalopram. It violently disrupts the exact same acetylcholine system that every other drug on this list has been attacking. A major 2-1 psychiatry review looked at old adults taking various SSRIs. Within the very first 1-2 months, the folks on paroxetine showed measurable crashes in their short-term memory, word recall, and overall attention. Seniors taking this specific drug were 30% more likely to show early signs of cognitive impairments compared to those on different antidepressants. There is a bitter irony here. The medication is prescribed to help stabilize the mind, yet over time, it may chip away at the very clarity it was meant to protect. The fix here is straightforward. For older adults, paroxetine is generally a medication worth steering clear of when alternatives exist. In fact, a formal medical catalog of medications considered potentially inappropriate for seniors explicitly blacklists this drug for the exact reasons. If you take it, ask your doctor about pivoting to a safer SAI like sertraline or escitalopram, which are much gentler, and don't carry that massive cognitive tax. Keeping healthy levels of B vitamins, especially B6 and B12, can also help support your mood alongside these changes. 2. Antipsychotics. Number 2, prescribed so quietly that many people taking it don't even realize what category of drug they've been handed. We are talking about antipsychotic medications. And this one worries me deeply because a massive chunk of folks taking these drugs never knowingly signed up for an antipsychotic. The heavy hitters include quetiapine, risperidone, and olanzapine. Originally, these were developed and approved for severe psychiatric conditions like schizophrenia and bipolar disorder. Today, though, they are constantly prescribed off-label to older folks, just a mild restlessness or the basic agitation tied to dementia itself. Incredibly powerful drugs built for severe psychiatric illness are now routinely passed out in homes and care. Facilities for seniors who are simply confused, restless, or becoming difficult for stretch, then caregivers to handle. The cost can be brutally steep. A massive 22 longevity study tracked over 2,000 older adults and revealed that those given antipsychotics for basic behavioral symptoms were 70% more likely to experience rapidly worsening cognitive decline within a single year, even with zero prior history of dementia. These medications also heavily raise the risk of stroke, sudden cardiac death, and the intense sedation that leads straight to falls and hospital stays. They work by heavily suppressing dopamine, a chemical connected not just to mood, but to your ability to focus, plan, and remember. Suppress someone's dopamine hard enough, and their brain grows slower and way less responsive. It's why so many patients on these drugs seem emotionally flat, dull, or nearly vacant, forcing families to grieve the slow disappearance of someone who is physically still right there in the room. If you or a loved one is on one of these medications, the very first step is looking the prescribed doctor in the eye and asking a direct question. Why was this started? And is it truly medically necessary, or is it mainly for convenience? More often than not, behavioral issues can improve without a single pill through consistent daily routines. Turning down the noise and overstimulation, treating hidden physical pain, and improving sleep and lighting. When the medication is genuinely required, utilize the absolute lowest effective dose for the shortest possible stretch helps limit the damage. Far too often, families are never told what these medications can do to the brain. They watch a devastated decline they assume is just aging, when the true cause is entirely chemical. One anticholinergic polypharmacy. And now I've at number one. The twist here is that number one isn't a single medication at all, and it may very well be the biggest hidden driver behind every single story we've covered today. Number one is anticholinergic polypharmacy. It is the massive danger almost nobody talks about, and it may be the leading cause of medication-induced memory loss in old adults. You were probably expecting one final villain, one single worst pill to take the crown. The reality is a lot more nuanced. The greatest danger almost always comes from the slow, silent compounding effect of taking several different anticholinergic medications all at the same time, with absolute no tallying up the total toxic load. Polypharmacy simply means taking a lot of medications at once. The anticholinergic burden refers to the combined effect of all those drugs blocking the exact same memory-related chemicals simultaneously. Picture a very common scenario. A senior takes diphenhydramine every single night to sleep, swallows oxybutynin every day for bladder control, and takes amitriptyline for nerve pain. Individually, each pill might produce a tiny, barely noticeable effect. Together, though, the effects violently stack up and the load on the brain rises incredibly fast. A massive 22 aging study tracked over 280,000 older adults. They found that folks carrying the highest anticholinergic burden had a jaw, dropping 20% high risk of developing dementia within 10 years. That is more than double the risk. And the vast majority of them had absolute no clue they were even taking these types of drugs. No one had ever explained it to them. When your acetylcholine is blocked from several different directions at once, the brain doesn't just slow down. Neurons physically begin to weaken from underuse. Connections can shrink and the brain settles into a quiet, underpowered state that closely mirrors Alzheimer's disease on cognitive testing. Here is the highly hopeful part, and it is the exact reason I made this video. Medication-induced cognitive decline is highly reversible when you catch it early. Reduce the toxic burden, and many people regain their clarity, their energy, and their memory within weeks or months. The brain is far more resilient than most people assume, but only once you remove the source of the harm. The fix doesn't require a miracle. It requires a ruthless, careful medication review. Sit down with your doctor or pharmacist and go through every single prescription, every over, the counter product, and every supplement you swallow. Ask them to tally your total anticholinergic burden. Simple standardized scoring tools exist to help identify this exact risk. Once the problematic drugs are flagged, the unnecessary ones can be reduced or discontinued under strict medical supervision. Safer alternatives can be swapped in, and the brain can be given a genuine chance to recover. This may be the single most preventable threat to the aging brain on this entire list, and that is exactly why it claims the #1 spot. Now, I want to hear from you. Out of these 9 medications, which ones are sitting in your medicine cabinet right now? Have you noticed brain fog or growing forgetfulness creep in after starting a new medication? Tell me in the comments below, and tell me you'll ask for a medication review this week. Your answer might honestly be the very thing that helps the next person reading it. And before you go, there's one more place your body hides its warnings. Your medicine cabinet is one place, but your hands are another. Your fingernails can reveal massive warning signs tied to your kidneys, your blood, and even your nervous system years before any other symptoms show up. But most folks never learn what to look for. That is exactly the topic of the next video. I'll walk you through the 4 nail signs you need to check tonight. Stay sharp, and I'll see you next time.